Hi guys, it is Nicola here from Sports Rehab Academy. Excuse the sunglasses. Well, it's such a gorgeous sunny day today after days and days of snow. I couldn't resist just getting out and getting some fresh air for a little bit. So, episode of Anatomy Corner here. We're not really going to be talking about the anatomy of the origins and insertions of any muscles or anything like that, but really thinking about the mind. I was on a course a couple of weeks ago with a guy called Damien Mark Smith, who is about the most amazing person when it comes to mindset, and he was sharing a really startling fact that's really stayed with me in the past few weeks, which has been that vets, those that are practicing veterinary medicine, have the highest suicide rate, 5 times higher than the next candidate for those that work in the health profession, that are health professionals. And this statistic and this thought really stayed with me recently, because from the outside in, looking at vets, they have this really amazing job, don't they? I absolutely love animals, particularly dogs. And to me, the idea of being a vet, it's just would be such an amazing, such a cool job to have. But then it didn't take long of thinking about it to realise that actually it's an incredibly challenging role. They do have to deal with death. They have to put animals down. Often it can be a companion animal that we have a similar relationship to that we would have with a child. Very, very difficult job. And it occurred to me that, not that I have any, amazing deep understanding of mental health and of, what kind of depression somebody can be going through before they think about attempting suicide. I do not have, a deep understanding of that. But it started me thinking about how difficult their job must be. And one of the aspects I thought that must be so hard is they can't talk to their patients. They can't talk to their patients. Their patient can't tell them where it hurts. And it just gave me this sense of kind of proportion of, if I'm having, or if you're having a difficult day, a day when perhaps you're not loving being a manual therapist, you're not loving being an osteopath or a massage therapist, at least, please, if you get anything from this video, just take a minute to be grateful for the fact that you can talk to your patient, so your patient can tell you which side of their back is hurting. Your patient can tell you if the pain is sharp or if it's dull. You can really have a meaningful relationship verbally with your patient, and that is something that vets don't have. So I just wanted to take a minute to share that with you, and it's been on my mind a lot in the past few weeks. So I hope you find that remotely useful. Slightly different type of Anatomy Corner video today. If you did find it useful, then do give us a like and a share, and remember to visit the video blog at Sports Rehab Academy that is called Anatomy Corner for other videos like this. Cheers now, have a good day, bye bye.